Hello, my name is Wood Pope. I'm a general orthopedic surgeon at OrthoGeorgia specializing in shoulder, hip, and knee conditions. Today I wanted to talk to you about knee replacement. Knee replacement is by far the most common joint replacement surgery we do as orthopedists. Typically this is done for degenerative conditions such as osteoarthritis. Occasionally trauma and fracture can lead to knee replacement. But again, by far the most common diagnosis we do knee replacement for is osteoarthritis of the knee. Osteoarthritis is the degenerative wear and tear of the articular cartilage. The cartilage is the smooth surface of the end of the thigh bone and the top of the shin bone that allows your knee to move smoothly and painlessly. When you lose that cartilage, that motion then becomes quite roughened, stiff, and painful. We typically treat arthritis sometimes for years with anti-inflammatories, bracing, low impact exercise, occasional injection, but ultimately wear and tear of the knee can lead to knee replacement. This is a model of a knee replacement here on the table beside me. Knee replacement surgery typically is less than an hour. It can be done typically as an outpatient, occasionally inpatient, depending on the age of the patient and their activity level. The anesthesia, you can either choose to be put to sleep or have this done under a spinal anesthesia, and spinal anesthesia essentially means that you're numbed from the waist down and sedated so that you're in a twilight sleep. You don't have any knee pain or control of the leg, and you're able to have this knee replacement without any discomfort. The surgery itself is initiated by an incision straight down the front of the knee, just on the inside of the kneecap. This is the kneecap right here in the front. This gives us access to your native knee joint. Typically, the thigh bone, otherwise known as the femur, you make 5 separate cuts on the end of the thigh bone, sized to your bony anatomy. A metal cap is essentially put on the end of the thigh bone. Attention is then turned to the tibia, and a flat cut is made across the tibia, and a metal tray is affixed to the tibia. This plastic insert is made of polyethylene. This gives you your new articulation between the end of the thigh bone and the top of the shin bone. This then restores your ligamentous tension on the medial and lateral side of the knee. It also restores the nice, smooth gliding motion that a knee joint typically has. One thing that we typically do is resurface the backside of the patella. The patella is about 25 millimeters thick. The patella is shaved in half, and about 12 millimeters of bone is removed and replaced with a plastic button. That button will then reside in this groove known as the trochlear groove. So if you were to look at a knee from the side, an artificial knee, that plastic button then rotates within this groove, and it restores nice congruent motion within the knee joint. As I said before, the knee replacement typically takes about an hour. If you have this done in the surgery center setting, you then transition to the recovery room for approximately 45 minutes to an hour. A physical therapist will then come by and get you out of bed. You will walk with a walker around the recovery room. Once you're deemed stable, you typically are discharged typically about 2 hours after the procedure. This also is done in the hospital setting, depending on the age of the patient and medical conditions that would require hospitalization. If it's done in the hospital setting, you then transition from the recovery room up to your room, where you will again meet physical therapy for an episode of getting up and walking, placing full weight on the now replaced joint. The surgery recovery is typically about 3 months. You will be seen back in the office typically at the 2-week period, the 6-week period, and then the 12-week period. I tell most of my patients that they'll use the walker typically about 2 weeks. They will then transition to a cane somewhere between 10 to 14 days when they and their therapist think that they're safe to do so. Most patients have weaned from their cane by the 4 to 6 week time period. We do typically treat you with a baby aspirin as a blood thinner to limit any risk of blood clot. I always tell my patients that the most important way to ward off any type of blood clot is to be up and about and be active as much as possible. Thirdly, I mentioned to patients that you will require pain medicine, usually 5 to 10 days, occasionally longer, but most times by 2 weeks you've transitioned to over-the-counter medicine. We do use a regional block, which is a nerve block about the hip that does significantly limit pain for the first 12, sometimes even up to 24 hours post-operatively. This allows you to get up and moving really before ever having any sort of significant knee discomfort following surgery. If you feel like you have symptoms significant enough to be evaluated for knee replacement, please do not hesitate. Call us at OrthoGeorgia for an evaluation.